Mustafa.
Yeah. So our next speaker is a pillar of this prestigious meeting.
Yeah.
Dr. Mustafa ZAKARIA, MD. He's Deputy Executive Director and Administrator for the IVF ICSI, Reproductive Medicine and Endometriosis Research Group. Dr. ZAKARIA obtained a master's degree in clinical embryology from Northwestern USA and consultant reproductive obtained the research fellowship certificate from IVF ICSI 2020. He had a distinct interest for oocyte somatic cell communication, embryo morphology, optimizing quality in clinical IVF, a lab member of ASRM and ICSI with many eminent definitions for Dr. Mustafa. Dr. Mustafa is going to address duration of the effect of fertility and the insulin resistance on IVF or ICSI results in women with polycystic ovarian syndrome.
Thank you very much, Professor Iman. Today I will talking about the development of insulin resistance in PCOS update 2021. First of all, in polycystic in ovarian syndrome, emerging case of infertility are beginning for an affector in Frank 1995. Okay, what's the meaning of infertility factor to 6 quickly? 14 minus 15% of infertility cases are causes of factor in women. (14 minus 15% of cases in factor in men. So this is slightly very important. Cases of infertility in women. In what cases female infertility? You are many impossible cases of infertility. However, it can be difficult to exactly some of cases without any implantation of infertility. So, with middle fasting of PCOS. PCOS is very interesting with in cases of infertility women. PCOS, a comment, a hormone disordered woman of a child agar. Women with PCOS is many have impacted excludes of livers in man hormones. The ovarium can be developed sample with collection to file in not regular units in recent age. Diagnosis created for PCOS. A woman has PCOS if she meets into the following three criteria. Clinical, in a biological, in a human being treatment. In polycystic ovarium ultrasound, the pieces on 12, the fluid on 2 to 8 mAh. Why for insulin resistance with ovarium volume in up 10 mm. Exclude diagnosis. The absence for ovarium to graze for HCS trim, insulin resistant. In women with PCOS, accepted to even more common, up to 15% present to ups in ups to women. Pathology. In pathologic, the receipt of gynecomatic GnRH place around in a normal. What more improves the blood. We want collection of releasive LH and FSH to gain and transport where is the blood to ovarian. Ovarian estimation of the factors this working together, LH and FSH. I want floor of patient, especially of progesterone, and after ovarian to diagnose with Christ. PCOS, a cause present factor, does not mention or remember that progesterone from ovarian cells has a negative effect. Why to GRN? Keeps the factor in a normal range, which keeps in LH in FSH. The quality of PCOS to dial and increase a normal range with the dial of progesterone. So don't forget with clients with this increase in progesterone. The increase GnRH hormone was a factor of increase with LH in receive to FSH. Once LH screening, the scale are more resistant with the factor of GnRH and PICE. More, this is very important to contact this LH. Here in hypothalassemia with PCOS in LH is relation to high in FSH low. In a full affection with physiologic, which can be affected. In why? In ovarian with PCOS, so they are in things that's from in ovarian. FSS is need to help to follicular in a pen. This was in can. This is correct with the power of PCOS with LH. Up to 13% to 14% of women with polycystic in ovarian syndrome. Also, you have an insulin resistant. Okay, it is well known that insulin resistant is a key factor in evaluation to development of disease. However, it's all confused with connected now. So with cases of PCOS in synchronous. PCOS, the liver of a sygnogeny, a free and androgenous, we need increase to androgenesis in significance of insulin in concentration with insulin resistant. So invariant stimulation with unconcentration. in 6 hormone to be applied. Physiology of PCOS. So you have 3 groups. Group A and B. It's very interesting. Why? For classing of PCOS women, which classified in more than club in OBET. More than for cycle of like in have to insulin resistant diamonds, we have to liver function test. And so this is a big problem in liver disease. Impotency also with cells in PCOS, with you have to hypertension in screening with the risk of women. So between class of PCOS in primings D. Infertility treatment in PCOS often increases decline means to correct treatment in ovarium to indicator with great method. Why of ovarium segregator. Also, the cases of include infertility problem with IVF of the perfect on treatment. And absolutely of this published in this articles within Association of Negative Research is very interesting on IVF in ICSI in result with women of PCOS. What was in N13? In effect in hormone deliver the notion of invariant stimulation as to insulin. This was contact with of in FSH in LH, in testosterone in androgen with the of these cases. In ovarian stimulation with women who are insulin resistant, however, to give all we SHBG. This is very interesting. Does insulin resistant negative affect IVF result in women with PCOS? Hormone concentration of ovarian stimulation. In concentration of FSH, LH, in testosterone, and what's the between the group? In concentration also with sunrise of FSH in stimulation of transfer with spherical with low in insulin resistant. Ovarian stimulation of IVF. So number one of a normal fertilization in oocytes in proliferation the cycle of embryo transfer. The day of an embryo transfer, a number of in implicates we are to select in insulin resistant. So, for example, in cell and production for embryo transfer in day 3, setup of in embryo transfer in day 4, some like in day 4, in day 5, same with good quickly result. Insulin resistant had an effect on hormone levels, diagnosis of ovarian stimulation. The effect in insulin resistant infertility treatment in examination in clinical. So It was found that problem in one effect of a normal to everything. So, in hypostimulation, in syndrome with in pregnancy, outcome, insulin resistance does not completely its IVF result. In studies, our women with PCOS interview was low. This affecting an FSH. Ovarian breast stimulation, so with increase immediately. This pattern in blood. This body, we have to rest and connect the reg. So in collection of reg. And broke it in 1997. Clinical result in insulin, in insulin resistant infertility women with PCOS. Yes, and you have a woman in 29 in classific of insulin resistant. So, you want in the following of in CIDMA classific of as to insulin resistant. How to work for and end up with children in 13 after in before minus in after minus. Insulin resistant in PCOS in how it may be case infertility. You know, what imaging of cases in infertility is a one-to-12 of result. Insulin resistant with a normal with good document of clinical fertilization of in your body for in a non-insulin resistant. So, infertility women with polycystic ovarian syndrome, this is the meaning of and very interesting with in contact with in clinical in hospital for medicine. Okay, insulin resistant in PCOS, and you have many of cases of infertility with Dr. Professor Longhans of Australia. You can show.
If you've watched yesterday's video, you know that insulin resistance is a basic of polycystic ovarian syndrome. And PCOS is a major cause of infertility. Medical professionals are quite quick to prescribe metformin to women with PCOS. Metformin, if you don't know, is a diabetes drug that improves insulin sensitivity. I'm not saying that's wrong, but in my personal opinion, drugs shouldn't be the first resource for insulin resistance. I think diet should be. Today I'd like to discuss insulin resistance and inflammation and how it all affects fertility. First of all, when you eat sugar. And by sugar I mean not only refined sugar, I mean starches like bread, even whole grain, pasta, potatoes, sweet fruit. All of these cause blood sugar to significantly rise, which causes an insulin spike. I've talked about this in more detail in yesterday's video, but let's recap. Insulin ferries sugar into the cells under normal conditions, and when the sugar is delivered, the cells in the pancreas they sense the lower blood glucose and stop producing insulin. When we eat too much sugar, the cells at some point shut down and don't absorb it all because they're full. And that then creates insulin resistance. The sugar and insulin then builds up in the blood vessels. And the pancreas, which senses high blood sugar, sends out even more insulin. So first, the problem is that insulin and other carriers can be quite caustic and inflame the blood vessels, which then shut down receptors even further. And as a result, the level of inflammation grows, and it's a vicious cycle. This then causes the body to bandage the inflammation, and it's doing this with LDL cholesterol. So you might know LDL as a bad cholesterol, but LDL doesn't cause the heart disease. It's, at the end of the day, the inflammation. If we wouldn't be inflamed, we wouldn't produce that much LDL in the first place. And when LDL is too high, because we are inflamed, then that reduces the circulation, which is necessary for proper development of sex cells and fetal development.
Conclusion. Effect of BMI to insulin resistance and successful of IVF in women with PCOS. In the collaboration of concentration in IVF outcome in women with PCOS is very interesting with IVF outcome in women. This is of honest and defiancy. Too much to insulin. In FSH production, increase in LH production. The cycle becomes so disappearance in ovarians, in hot to correcting with all metamation become resist. And what does mean become resist with need ovarian with the good quality of result with a different price of pregnancy. And this insulin resistant with good quality in time for PCOS. Thank you for your attention.
Thank you, Dr. Mustafa, for your excellent presentation. Thank you for your excellent presentation.
Thank you.